So today we're going to be doing a presentation on cerebral palsy, and it was done by Ashley, Raj, myself, Brian, and Alex.
So what is cerebral palsy? Cerebral palsy is a disorder that affects mobility and the ability to maintain balance and posture. Cerebral palsy has to do with the brain, and palsy means weakness, so it's the weakness of a brain.
Okay, so what causes cerebral palsy? So it's caused by an abnormality or disruption in the brain development. In most cases, the cause is unknown. Factors that can lead to problems with brain development include gene mutations, maternal infections, fetal stroke, bleeding into the brain, infant infections, traumatic head injury, and lack of oxygen to the brain. Risk factors include low birth weight or preterm birth, infections during pregnancy, infant illness, fever during pregnancy, exposure to toxic chemicals, jaundice, and seizures.
Different types of cerebral palsy. According to doctors, they classify cerebral palsy according to the different type of movement disorders that affect the patient. And depending on what area of the brain is affected, there's 4 different major types. First is spasticity or stiff muscles. This is the most common type, and it has 3 different ones under spasticity, which is spastic diplegia, spastic hemiplasia, or spastic quadriplegia. Spastic diplegia is muscle stiffness within the legs, and arms are usually less affected or not affected at all. Spastic hemiplasia affects only one side of the person's body, and spastic quadriplegia is the most severe form of spastic CP. It affects all 4 limbs, the trunk, and the face. The next type is dyskinesia or uncontrollable movements. Patients that have dyskinetic CP have problems controlling their movements of hands, arms, and feet and legs, making it very difficult for them to sit and walk. Sometimes the face and tongue are also affected with these patients, and it can change from day to day. So one day the patient can be rapid and jerky, the next day it can be slow and writhing. It just depends on what day it is and how it affects the brain. The next is ataxia, or poor balance and coordination. People with ataxic CP have problems with balance and coordination, so they might be very unsteady when they walk. They also have a very hard time with quick movements or movement that needs a lot of control, like writing, so they might just go on and scribble a little bit on the paper. The next is mixed cerebral palsy. With this type of CP, patients usually have different symptoms and different types of them, so they can have dyskinesia or ataxia at the same time.
So developmental delays. So the first sign of cerebral palsy are often developmental delays, and these can be slurred speech, cognitive impairment, and problems using fine motor tasks like writing. There's also gross motor tasks, which are head control, sitting, crawling, walking, and these patients often require chairs and other assistive devices. There are language skills that may be lacking, such as lack of coordination of muscles in the tongue and around the mouth, which can cause slurred speech.
Okay, so tips for raising a child with cerebral palsy. So love and play with your child. Treat your son or daughter just as you would with a child without disabilities. Learn from professionals and other parents. Ask for help from family and friends. Keep informed about new treatments and technologies that may help. Learn about assistive technology that can help your child, and be patient and keep up your hope for improvement.
This is how to care for a child with cerebral palsy. You can start out by being your child's at-home therapist, talk to them, see what they need. You can help them be active, focus on their diet, stay on top of their doctor's appointments because they're going to have a lot of them. Promote independence, practice their ADLs, which are activities of daily living. You're going to practice their grooming skills and their hygiene skills, and you're also going to make sure you take them to their physical therapy. The next are the medications or treatments that you can do. So you can start out by taking the anticholinergics, which helps uncontrolled body movements. You can take anticonvulsants, which are for seizures or to prevent seizures. You can take antidepressants for their moods. You can take an antispastic, which are muscle relaxers. You can take anti-inflammatories for your pain management. And some treatments you can do are physical therapy, occupational therapy, speech and language therapy, and recreational therapy.
Okay, so here we have behaviors. dependency, hyperactive, anxious, and prone to conflict with their peer groups. Children may also exhibit antisocial behavior. Cerebral palsy can affect a person's ability to use fine muscles around the mouth and tongue that are needed for speech, and this can cause a barrier to communication. Children with cerebral palsy may also may also have a short attention span, motor planning difficulties, and language difficulties. 1 in 5 children with cerebral palsy have a sleep disorder, and this can also cause further behavior issues. Next, we have services and support groups. There are home health nurses, which is an option to help with care of a child with cerebral palsy. Counseling services are in place for both child and family. Social workers, psychologists, teachers, and guidance counselors also play a role. Physical therapy can increase a child's capability and mobility through movement and stretching exercises. United Cerebral Palsy of Stanislaus County is a nonprofit that provides children programs and services. Occupational therapy aims to restore or improve a child's ability to perform specific tasks. Behavior intervention plans are available and will assess a child's current behavior, and a plan will be created to remove or minimize or treat the cause of the behavioral issues. And then next is our reference pages.